pulled up, we covered an article today on the, I got the federal isolation camps coming soon across Canada, question mark. Okay, so we went through service provider for federal quarantine isolation sites 6D112-202-772/8. Big boring, but you can type that in, look this up yourself, or go to our article and it's linked there. Let's talk about it being deeply concerning. Main reasons being the generality of the language and the refusal of the Ontario provincial government to answer independent MP Randy Hillier on their function. So surely the government is aware of the intentions to build these isolation camps from coast to coast. And my question to the Premier is, how many of these camps will be built and how many people does the government expect to detain? The answer he received did nothing to address the crux of the question. And the government House leader basically continued to talk about how this is a good policy that has been working. He was referring to people returning to isolate. But in the actual document itself, this is the cause for concern, everyone. The government of Canada is considering engaging a third-party service provider for federal quarantine isolation sites that will be used to house and care for people for public health. Here it is. And other related federal requirements associated with the COVID-19 pandemic response. So the government is seeking feedback. Basically, this is not an actual bid. If they win, there is no winning. They're not going to win an offer. They're not going to win a chance. So this is not a bid of solicitation. This RFI will not result in the award of any contract. More questions. Why put out a notice of tender? Breaking down the language. This was where it gets concerning. So federal quarantine isolation sites that will be used to house and care for people for public health and other related federal requirements associated with the COVID-19 pandemic response. Other related federal requirements associated with the response. So this is where I got concerned and I started posing questions in the article. What are the other related federal requirements? What if they start forcing PCR testing on everyone? By the way, I link in an article there that's linked to Operation Moonshot in the UK, where it was leaked to the British Medical Journal, and they talk about increasing testing, and basically everybody would be tested on a weekly to bi-weekly basis, depending on their job, contacts, and you would have to have that information on an app in your phone to let you participate in society. So I asked that question.
A lot of countries don't let you fly into their countries without getting a test beforehand of a flight, and you have to isolate even before your flights too.
Yeah. We're banned from the EU now as of recently because of our cases, which is ridiculous. Because obviously, what does that have to do with anything? If you're healthy, you're healthy. But what if I refused because the PCR test is inherently unreliable? The creator of the test even said it shouldn't be used to diagnose illness. And specifically, he talked about how he had tried to use it to diagnose HIV, I believe it was. And he said, even though that was a rare disease, it still would pick up all sorts of other things. And it wasn't meant to diagnose illness. And when asked, well, is it useful? And he said, well, yeah, it tells you all sorts of things about basically what's in the body, but it doesn't tell you whether not somebody's infectious, or if there's enough viral content, or even if there was a lot there, that still doesn't prove infectivity. So what if I come into a contact with a probable COVID exposure? Even with no symptoms, could I be subjected to a COVID test against my will? The generalities in this document should concern each and every Canadian. Well, if I was at one of these facilities, what if I wanted to leave as I was displaying no symptoms? What would happen to me if I attempted to leave that facility? This was precisely the question that I posed to Onyx in Alberta, who was an early adopter in providing a facility meant to isolate COVID-19 patients. I asked what would happen if a person wanted to leave. Would they be prevented? I was told no, not by the staff at Onyx. I then asked if Alberta Public Health would bring them back or find them. I was given no answer and was then passed off to Alberta Public Health for an answer. I have yet to receive a response. So you can read that article a little bit more in depth about that. It's a good little introductory piece to what it's really about. I recommend it for people. It's concerning. So the isolation camps, like they're talking about, it's like if you came in from the country or something, or you're sick and you didn't have somewhere to isolate, it might make sense to provide a facility like that. But when you leave language open, like other related things to the COVID-19 pandemic, and we see some of the measures our government has been trying to make, it is always going to be concerning to leave that power in the hands of a government, especially one that has so many ethics violations, that has such a discontempt for the law. And continually does things to avoid accountability for their actions. I really don't trust that government to have that kind of power.